New at 5, the new Health First Indiana initiative has put an extra $2 million in the budget of the Vanderburgh County Health Department. 44 News reporter Josh Myers has more on how the funds will be used this year.
With that extra money in their pocket, the Vanderburgh County Health Department is planning to tackle some of the most pressing issues in Vanderburgh County communities, like infant mortality rates.
There are certain zip codes within our community that face really high infant mortality rates. So we're going to start to really focus and utilize this funding to increase our efforts in those areas.
Between 2017 and 2021, 1 out of every 200 white infants born in Vanderburgh County didn't survive to see their first birthday. For black infants, about 1 in 52. The second highest rate among Indiana's 92 counties. That stark difference has led the Vanderburgh County Health Department to dedicate much of the additional $2 million of state funding it received this year to its Pre-to-3 program. Through the free program, health professionals made over 20,000 visits to the homes of new parents in 2022, giving many underserved households personalized access to expert child care guidance. However, the success of the program has led to the health department finding itself understaffed.
Right now there is a waiting list for families who want the Pre-to-3 program, and there's not enough staff to be able to support that. We'll be able to actually hire more staff to be able to serve more families.
Lori Grimm, Director of Perinatal Services at the Women's Hospital, says the hospital plays an instrumental role in connecting the health department with the people who need their services most.
From our side at the hospital, whenever they're here having their baby, we partner together to screen women to say, are you having trouble with food? Are you having trouble with housing? Do you have a safe place for your baby to sleep?
If the hospital feels the mother and child are at risk, the Pre-to-3 program is then able to follow up with in-home visits after they leave the hospital. A 2007 study by Cincinnati Children's Hospital found that infants who received in-home nurse visitation were 2.5 times less likely to die than those who didn't.
That is why this program is so important to our community, because it is one of those few programs and interventions that have really shown that they do make an impact.
In addition to addressing infant mortality rates, the health department plans to put funds toward increasing access to immunizations and expanding lead testing.
The health department also says they're always willing to work with community organizations, and they encourage them to reach out. Reporting in Evansville, Josh Myers, 44 News.